So being a surgical gastroenterologist, although I'm a surgeon, the most common symptom with which patient comes to my OPD is gas. Now, what is gas? Is it literally a gas accumulating within one's stomach, or what is it? So, there are different conditions or symptoms which one patient attributes to as gas. What all conditions can one presume as gas? One is gastroesophageal reflex, like whenever the acid content in the stomach regurgitates into the food pipe, it can be sensed sometimes as bloating. So that patient can call as gas. Second, sometimes due to gastritis or due to gastric ulcer, what happens whenever a patient eats something, he feels a burning sensation in the abdomen, slightly bloated, and that can be attributed as gas. And few people tend to burp a lot, and few people tend to pass flatus or fart a lot. So that is also presumed as gas. Now, being a gastroenterologist, we need to identify what is the actual problem. By probing certain questions, we can easily differentiate between gastroesophageal reflux, we can differentiate between gastritis or gastric ulcers, or we can differentiate into indigestion also. Now, can it be caused by some other conditions? Rarely it can be caused by gallbladder stones too. Now, when someone presents to us with gas, what do? We do not directly jump into doing certain tests. After asking questions, we get a fair idea of what the condition could be, and since it is not a life-threatening condition, we advise them certain dietary and lifestyle modifications along with certain drugs. Now, for gastroesophageal reflux and gastric ulcers, we prescribe them certain drugs which will reduce the acid content of the stomach. But if the patient passes gas a lot, flatters a lot, or burps a lot, then we will add certain things to reduce the gas content of the intestine. Now, what are the important diet and lifestyle modification one has to do? One has to restrict lots of oily and spicy food. They should take lots of fibers, fruits, green leafy vegetables, drink plenty of water, and they should regularize their bowel habits. They should avoid lots of coffee, lots of tea. They should not drink, they should not smoke, and they should not eat late in the night. So before 8 o'clock, one has to finish their dinner. They should not have heavy food during dinner, and at least have a gap of 2 hours before sleeping. So these lifestyle modifications along with the drugs relieves one of so-called gas in 98 to 99% of the people. After 2 weeks course or 4 weeks course, one is not getting settled with this gas, only then we tend to do certain investigations like ultrasound scan or endoscopy or colonoscopy to identify what is the exact cause and then treat them. So though it's a very common condition called as gas, it's very easy to treat and it's definitely not a life-threatening condition. I describe few lifestyle modification. If one follows this, even before going to doctor, if they are getting relieved of this gas, then nothing to worry at all. So if you have gas, follow the lifestyle modification, have a healthy lifestyle, do exercise regularly, walk for 5 kilometers daily within 45 minutes and have a healthy diet that will keep your gut healthy. Thank you.